Good morning, everybody. This is Dr. John Willardson. I'm here with Memo Hea, and we are here in beautiful Newport Beach, California with Trust Implants. And today we are going to discuss a lot of different things, different topics. Patients oftentimes will ask us, certain questions about the process. And so we want to go through some of those questions today, answer your questions if you're here on live with us. Sorry about the late start again. We had some technical difficulties. We actually did start on time, and we did about 20 minutes of live stream, unknowing that it was not live. So we apologize for that. And also last week, I was in surgery every day last week. And so I apologize for not having a live stream last week because I want to come at it prepared and organized, and I just did not have time to have everything ready for last week's live stream. But today we've got some really good information, and really excited about today's live stream. So, how was your week, Memo?
It was good, Doctor. Just like we talked before.
We've been through this once already, so not knowing it was not live. So
yeah, but good. Getting ready for Christmas, right? It's that time of the year, and like I mentioned, just kind of planning for next year.
Are you headed home for Christmas? Because you're from Utah, right?
Yeah, my family lives in Utah. Yeah, so I'll be there. I told my mom just for 2 days, so I'll get there 24th in the morning, and I'll leave on the 25th at night.
To come back here?
Yeah, because I just want to be there for those 2 days. Because in our culture, since we're from Mexico, we celebrate 24th.
Right.
I don't know if that's how it was in Argentina.
It was, yeah. 24th was a big
yeah,
deal, yeah.
That's where you have like your dinner and like your gift exchange, and then
lots of fireworks.
Yeah, and then 25th is you just relax, right? So, but it's cold up there, so I'm just gonna go and come back.
You're getting soft.
Yeah, I know what the cold I am.
It's crazy when you go back to a cold state. After being in California, you realize what a wimp you are.
Yeah, well, here it's the middle of December, and you're walking around with like short sleeve shirts, and it's nice.
We got it pretty good, so I can't complain.
Yeah, it really is. How was yours? How was your week?
Yeah, it was good. Again, last week was kind of wild and long and crazy, but it was good. Good weekend. My son Seth, who's on his mission in Dominican Republic, he's coming home in January, so we're getting ready for that, and it's been fun kind of talking with him now that he's kind of on that downward slope. You can see in his mind he's starting to think about, oh gosh, this is real. I'm actually going to be, because while you're out there, you think it's never going to end, right? I remember walking the streets of Argentina thinking, man, is this ever going to end? But it does eventually, and it's such a great thing. But he's, it's interesting because as a missionary, he has no outside influence really. They don't listen to music. They don't have really the social media, and so they're really separated from the world. And I think it's actually harder to come home. I felt like when I came home from my mission, it's like I was dropped on my head, because all of a sudden you got to figure out, okay, how do I do all this stuff again? You kind of forget, but it's a good thing. I'm excited to have him come back, and he's worked hard and done a great thing there. So, but yeah, everything's good. So.
Well, I can go ahead and cover these.
Okay.
So they're, like Dr. Willardsen was saying, because I'll be kind of bringing up the misconceptions or myths, and you as a professional doctor who's been in the industry for
a long time,
20 years. And not only that, doctors, one thing that our viewers don't understand is that you can go anywhere else, and they've been placing implants like here and there, just a general practice. And I know you'll never bring this up, but for our viewers who don't know, you've been specifically doing dental implants for the last 20 years. Like that's what you went to school for, and right out of school, that's what you've been placing. So you fully specialize on that. So I would say your thoughts on this from doing, hundreds, maybe even thousands of cases. It's pretty valid for the whole industry. So it'd be good. I'll be bringing up these misconceptions. So the number one is, and we get these for all over our YouTube channel, comments or social media page, is dental implants are painful. So what do you have to say about this?
Yeah. So it's kind of a relative. Of course, when I meet a new patient, and pain obviously always comes up. But I kind of like to help them understand the the hope that's coming for them. If I have a patient like this photo here, and the breakdown of their mouth, I mean, they've experienced a lot of pain. If I look at this tooth here that's, rotten underneath the gum tissue, fractured off, certainly an abscess at the apex for sure. At some point, that tooth was very painful. In fact, the majority of these teeth, most likely at some point, were very painful. So the patient has experienced a lot of pain. And a lot of times they come to me because they can't take it anymore, but also they're so afraid of the pain that they may experience with implants. But so if we talk about the initial pain, which is the pain when I'm doing the procedure, there is no pain because the patient is intubated or under general anesthesia. So, and we do what's called a nasal intubation. So we put the tube in their nose. Sometimes patients think, well, that's kind of scary or that's going to be painful, but in reality, it's not. We have different dimensions and diameters of endotracheal tubes that will fit the patient's airway perfectly. So, if you were to go in for your gallbladder or knee surgery or whatever, you're going to be intubated through your mouth, oral intubation. So anyway, so that's how, and they'll say, well, is it safe? It's very safe. There's really not a safer place to be than to have, myself and Dr. Howell and the whole staff monitoring, managing, and maintaining your airway. So, so the pain, there is no pain at that initial stage. And then some of the following, and during surgery, I also give local anesthetic. So they're localized, plus they have general anesthesia. So they're not going to have any pain there. And then afterwards, there's a few steps that are obviously we have to do. And we give local for those steps as well. And then after the surgery, they have their pain meds. So I would say that it's kind of a myth, really. I mean, to me, the beauty of it is that there's hope at the end of this process. So a situation like this, when they are all done, it's problem solved. It's gone. The problem is completely solved. So,
and I also, just to say that, or sorry, to go along with that, what people have to understand is in the whole process, right? The planning, the placing the implants, the getting the prosthesis right, like everything, because patients are going to come in and like have to experience all of that. The pain is just such a minimal part of everything. Right. From all of the interviews that we've done with all of our patients, no one's ever brought up pain. And this is something that we just talked about, is we should start asking them, like, how was the pain? Like, what was it painful? Because they don't bring it up themselves. Like, once they have their smile and they go through it, and it's just with anything, right? Like, even if you go to the gym and you will work out,
you're gonna be sore,
and that's painful.
It's a good sore, though.
Yeah,
and this is actually a good pain as well, because you're making progress to restoring something that has been lost, and it's an important aspect of each of our lives, our mouths, our smiles. And knowing that it's going to be fully restored is huge. So I wouldn't, for a patient considering the procedure, I wouldn't get too hung up on the idea of on the pain aspect, because we help mitigate that and bring that, suppress it as much as possible during the process.
Okay.
Yeah.
So number 2, moving along, is dental implants are only for older adults.
Yeah. Again, I mean, it's dental implants or just reconstruction in general are for anybody who's in these sort of situations. Unfortunately, we outlive our teeth, and I've said it a million times, but this guy, I think he's probably in his late 30s, early 40s, so definitely not an older person, but obviously we have patients that are older that have lost their teeth. So it's really every person who is in a situation where they're starting to lose or losing or have lost all of their teeth. And then it is a matter of the quality of life. So even if it is an older adult, and sometimes patients think, well, I'm too old, I'm not worth the investment. But that's not true either. I talked a few live streams ago about one of the oldest cases I did. He was 92, and he even said, he's like, I don't care if I live only 5 more years. I want these next 5 years to be the best, So that's also a myth that it's just for older adults. It's for anybody who is self-conscious about their smile, is restricting their smile, has a difficulty eating, so it's for anybody that's in that situation.
Okay. Thank you. Number
Yeah, of
3
course.
myth is dental implants look unnatural.
Yeah, so again, it's a myth. So here's looking kind of at the downward view of the implant in the gum tissue. So you would think how in the world are we going to make this look natural? And that's my job, right? I mean, as I look at this photo here, you can see how nice and clean the tissue is around each implant. Tissue is very healthy. Emergence profile, how the implant and the tooth or the prosthesis emerge through the gum tissue. And that's all about materials and technique, right? Implant positioning, where these implants are located, also very important. And so now if I have a situation where, let's see, I hope I uploaded that photo. Oh, right here. Oh, no, that's not it. If I have a situation where the case has not been properly planned and I have an implant right in the middle of the midline, that's a challenge. It creates a challenge because I didn't place these implants. So there's got to be a plan while patient is under, while the implants are being placed. The surgeon needs to know what the end result is going to be, so that in the end we can achieve aesthetics that look like this. And this is just a temporary, but aesthetically it looks very nice, and functionally, now that she has all of her teeth replaced, she can chew and eat, and so they don't look unnatural. In fact, if we were to go again, I'll go back to maybe a case like this. Everything's kind of broken down. This has got to be fixed, right? I mean, it's like a totaled car. It has to be rebuilt, or a house that's been burned down. And so here's kind of a before photo. And so to go from here to here, it's all relative. It doesn't look natural. The smile is restored, his mouth is restored, and he can now get back to normal life. So, but it's not a natural tooth, right? I mean, it is an implant.
Well, I'd also would add, Dr. Willardsen, that it really comes down to what the patient wants too, right?
That's exactly right.
Because here we have an in-house lab, so you have plenty of pictures of prosthesis, which is the actual teeth, right? Like what the teeth look like.
Right.
And you really tell the patient like what shade of color they want it, right?
Exactly.
Do they want it like really white or a little bit yellow, and also with the gum?
Yeah.
So it really comes down to, because we even have pictures of people who just didn't want them too white, like too veneer looking, that I look at the pictures and I can't even tell. So they look like their natural teeth. Pretty much.
So again, to restore the patient back to normal, natural function, and to give them back a smile that they can now be proud of, it's a game changer. And so obviously I've got thousands of cases I can show, but what I can say is, so sometimes when I'm going through this process, I'll give the patient what's called the temporary, or the PMMA, and I'll put it in the mouth, but sometimes I've had to remove it. And on those times where the patient has worn it for maybe a week, 2 weeks, or whatever, a month, and I have to take it out, they are not happy. Like they do not want that taken out. And I just have to take it out sometimes to do some different like changes in the lab or add something here or there. So prior to me putting it in their mouth, they've kind of become accustomed to whatever it was, their teeth that were failing, or a denture or whatever. But once I've put it in and I've torqued it down and it's in there solid, and if I have to take that out, they are very adamant about me not taking it out. So that to me tells me that now that they have experienced what it's like to have it in their mouth, the prosthesis, the implants integrated, and everything functioning how I know that it's going to function when we're done, now that they've had a glimpse of what that's like, they can appreciate what we've done for them. That's what I'm trying to say. So
perfect, great. Before we move on to the next one, we actually have a comment from one of our viewers. He's saying, hello, can you talk about the different types of final prosthesis? And so they put PMMA, PFM, EMAX, and then CFZ. I don't know all the other ones. But
yeah, so PMMA is polymethyl methacrylate. It's just plastic. Now, today, because we do CAD and design, and we mill everything with the milling machine, and so we have a disc of. I can change the disc to whatever I want. I can have it be zirconia, PMMA, and so we like to use the PMMA first, so that I can make any adjustments, check the midline, smile line, aesthetics, shape, and then adjust the occlusion, the bite, because that is so critical. And some of the videos you'll see on YouTube of us adjusting the bite, ask my staff, they go crazy because it's kind of the same thing over and over, but it has to be dead on. There cannot be any, like if I have one tooth that's hitting on this side a little bit and the others are not, and then maybe one that's hitting over here and the others are not, that case absolutely will fail. It has to be complete and absolute articulation. So when I articulate the case and the patient touches throughout the entire arch evenly on both sides, it's critically important. So that's where materials are even zirconia can fracture if it's not adjusted properly, right? So talking about EMAX, PFM is a porcelain fused to metal, which we don't really even use that much anymore. It's been a long time since we have used PFM, but EMAX is what they would use for crowns, sometimes veneers. But with implants, we need a stronger material, so we mainly use zirconia for the prosthetic.
And so zirconia, out of all those, is just the best option? Yeah,
it's a solid block of zirconia that's, we fire it, and it's kind of like forged, I guess, to strengthen it. And so today, with proper diagnosis, treatment planning, implant placement, and then execution on the prosthesis and materials, it's the best outcome we can give right now. So
okay,
yeah.
So that's what we want at the end, right?
Definitely. Obviously there are corporate implant centers that are doing still the hybrid, which is a resin wrapped titanium bar. So yeah, and we've seen pictures of those cases that they don't feel very natural and they tend to break. So
okay, thank you. Yeah, that comment or that question was from Strum and Son Plumbing. So they've been doing their research.
Yes,
right?
They have.
They've been
Absolutely.
looking into different prostheses. So we'll hopefully see you guys here soon.
Yep.
Okay. The fourth myth or misconception is dental implants require special maintenance.
I have a picture for that. So it doesn't really require special maintenance, but if you're going to go through the process and you've already experienced this where teeth are failing. This patient has some implants and some teeth, old implants that have now lost bone and tissue around them. So they, special maintenance, no. It's just a matter of maintenance. Yeah. So you can't really expect to invest in your mouth. This is a case that we put in the mouth, and then within about 3 months, I see them again, and I see all this tartar buildup, tissues becoming inflamed. And, so it's almost like they've fallen back into those habits and are not maintaining it as, like they should. And so it does not require special maintenance, but it just requires maintenance.
Yeah.
Like your teeth, right? I mean, I would never consider going to bed without brushing my teeth, waking up without brushing my teeth. And with implants, you just need to know that you just have to do that. There's no other way about, you have artificial materials in your mouth, they've got to be maintained. If they are, this will last you the rest of your life. I had a case that I saw last week. It was a patient I did 20 years ago, and I haven't seen her since like 2004, I think. And she had a implant crown that had fractured off, and which we backed the screw out, and everything was fine and made her a new crown. But the bone level, her mouth was pristine. No tartar, no plaque, no buildup. She maintains it very well. Implant bone levels around all the implants. She has like 7 implants, but all of them had perfect bone levels, and it's because she's been really adamant about maintaining it. Yep. Whereas I'll see patients that like this is a new prosthesis, new implants, a lot of tartar buildup. What's that going to look like in 5 years? It's going to look like that. And so you can see the bone level has pulled away, the tissue's pulled away. I've got implants exposed, threads exposed. Again, I did not place these implants, but I'm trying to help this patient get back to a somewhat normal situation, which we pretty much have, but I can't do anything about the fact that these are all exposed. All the threads are exposed. And when I have exposed threads, the implant itself is more susceptible to adhering tartar, plaque, bacteria. So that's just, you want to consider these things because it's avoidable. Like my patient that I did 20 years ago, she's maintained it. She's valued the efforts and the investment she's made, the efforts that we've made, and she's maintained it properly. And as a result, she's still benefiting from it. He's benefiting as well, but this eventually could end up being a real problem. And he's got a lot of money invested in his mouth. So.
Yeah, and you want them to last as long as they can.
100%.
Right? That's the thing that people don't understand is, like, you still have to brush. It's not like you put them on and then just and just not ever use mouthwash or any of that stuff. First of all, like, I feel like you feel better when you use mouthwash and you brush, like you feel like clean. But I mean, if you want to relate it to something else, it's if you buy a brand new car, you still have to do oil changes every 3 months.
Change the oil.
Yeah, like
rotate
if you're
the
like,
tires.
oh, it's brand new, I'm not going to do an oil change for 3 years.
Right.
That thing's going to break in 6 months. So.
And it's the same thing. I'm glad you used that analogy because it's actually even more critical because we're dealing with live tissues and they don't react well to bacteria infection, nidus of infection. So a nidus would be like the tartar, the debris. It's like a stimulant, right, for an infection. And this is how the tissues and the implants should look. You see how nice and clean and healthy that tissue is around each implant? And so this is how it should look. And if it is maintained like this, it'll stay in this position the rest of their life. Now, if the patient continues to, where's that photo at? If they continue to not maintain it like this, it will run down the long axis of the implant, and eventually you could lose the whole thing. And like we were talking about the patient who I put the provisional in and then took it out, and how frustrated they are at that process. Imagine losing the entire prosthesis, implants, and everything, and that can happen. And so I've never personally have had it happen on any case of mine, but I've seen cases where we've had to extract all the implants, especially on smokers, or we've had to remove everything and start over, and that's a whole expensive, long process. So just maintain it. That's all.
Yeah. So no special maintenance, but just maintenance.
Just maintain it.
Yeah.
Take a mechanical debridement is what I say. Just get a toothbrush in there and scrub that stuff off of there. That's all you got to do.
Okay. The next similar we're going to talk about is number 6, myth. Dental implants are prone to failure.
Okay, that's another good question, or myth, I guess. They are so prone to failure. Again, goes back to materials, goes back to surgical technique, goes back to so many variables. And I think my head just starts to kind of explode because so much is ruminating through my mind. Like, okay, so how was the osteotomy prepared? What kind of, graft material did they use? Was it immediate placement or not? How, lot of variables and factors on implant failure. All I can say is for myself, I have little to no implant failure. I don't know what other, what's going on outside. I had a patient last week that I had restored her case about 5 years ago. She's from Romania, I think, and had gone back to Romania and had some dental implants done in July. It's now December. And had those 2 implants done. I was kind of scratching my head because I looked at the CT. I'm like, I don't think I placed those implants. I can't remember every case that I do. So, I don't remember placing those. But then she kind of coughed it up. She said, oh, no, I had implants done in Romania because I thought the implants that I had placed were failing because both implants were failing.
Okay.
And I was like, oh gosh, what's going on here? So, and then she's like, oh no, I had those done in Romania. I'm like, okay, makes sense. So materials, surgical technique, positioning is all plays into, it's so important. And so,
Yeah. And going along with that, as probably 6 months, almost a year ago, we covered a news article, remember?
Oh, yeah,
That
yeah.
came out about dental implants and just the
Yeah.
failure of it. And kind of like Dr. Willardsen said, is we broke it down like step by step because there's so many variables that come into play
Yeah.
for it not to fail. And again,
100%.
Dr. Willardsen's been doing it for years, so he knows it's material, techniques, like, how you're doing the surgery and all those things. Like you said, you
Yeah.
have almost no failures. Or I don't think you have any failures.
Oh, I've had implants fail, without a doubt. Nobody, I don't think, I mean, nobody that's been in this game for a while can say they've not had failures. I've definitely had implants fail, but considering the volume of implants that I place, I have little to no failures. So
Yeah. It's like out of 100 shots, you've made 99 and probably missed one.
I would say out of 1,000 implants, I would say probably maybe 5 have failed.
Okay. Yeah, it's pretty,
So very low.
very, very
But
low.
sometimes you just. But I can say that I've never had a case fail, and I've not been able to fix it or restore it or put an implant in. That I can say. So
Which is the important part.
it is because I can fix my complications or failures or whatever. I know how to. I can fix that.
Yeah, and here in Southern California, we get so many people to go down to Mexico or somewhere else just to pay, 10 grand, 15 grand for the whole procedure, and then they go back and the clinic is nowhere to be found, right? So it's like they have to come here, and then they kind of have to start over.
Or they have failures. Implants fail, prosthetics fail. So, and those are different types of failures, right? There's the implant itself falls out or gets infected, or the prosthesis or the teeth break, which is as big of a failure as the entire thing falling apart. So, okay, well, good. So let's kind of move along into. I'd like to show this case here, and I want to talk about So we've talked about the pain and failures and whether they look unnatural and maintenance. All of those are important variables to consider when having the procedure done and restoring your mouth to ideal aesthetics and function, right? But let's talk about the patient, and I don't want to show his face, but you can imagine in looking, and he had moved in the CT, so you can kind of see it's not real clean, this picture, but he's got his canines, his his centrals that were all just decayed and broken down, and then he has some implants. So again, he's one of those cases, he's tried everything that he's known how to do to get his mouth fixed. He's certainly invested plenty of money. He's probably got $50,000, $60,000 invested, and this is where he's at right now. He's got implants on the upper right-hand side, lower right-hand side, and then all the crowns on the bottom. And so I want to show this case because when I first met him, and he came to the office, he would not even look me in the eye. He was so, I don't know, I guess he probably felt, he just was embarrassed. I know that to be the case. And so his confidence was down to nothing. His frequency was very low. Mm-hmm. I could sense that, right?
Yeah.
And so after kind of talking with him, and it took him a while to commit to doing the treatment. He was kind of going back and forth on what to do. And at first he's like, well, maybe I'll just pull all my teeth out and just do a denture and just stick with that. So, but ultimately he came around and he's like, you know what, I want to do this. I know that I need to do this, and I don't want to live in a denture the rest of my life. So here's his before CT scan. And talking about some of these myths and things that we've been talking about. So here is, we went ahead and we pulled all of his teeth and we kind of staged it out. So, he wanted to just stage it out with doing the extractions, bone graft, sinus graft first, and then a few months later do the implants. And so he ended up committing and doing the implants, and then on Wednesday I did his surgery. And so here is the preoperative CT scan. So after I've removed the teeth, done all the grafting, rebuilt this ridge, and you can see how nice and fat this ridge is now. I've got plenty of bone to work with. I've got bone in the sinuses. So, but I want to show a little bit about, well, here's a case from another, one of these all-on-4 centers that would approach the same patient this way. So pull all the teeth out, put in 4 implants, and then just call it a day. Whereas if you properly plan these cases out and good execution, you can get such a better outcome. And so here is his final CT scan. These are the 2 implants that were already in place, these and these ones as well. So I placed the remaining implants, and I did this through what's called a flapless procedure, and that's kind of what I wanted to talk about today. So what that means is I did not make an incision, reflect the flap back or the tissue back off the bone, and make my implant osteotomies. And the only time you can do that is when you know that you've got sufficient bone. It's kind of like flying an airplane in the clouds. You can't see anything, but you've got your instruments to fall back onto so that when you're flying, you know that you're safe, right? Because when you don't raise a flap and you don't pull the gum tissue off the bone, you're flying blind. Like you don't. But if you have proper instrumentation and I did the grafting and I have the CT, so I knew exactly where I was. But if I didn't have all that information, it's risky to do a flapless procedure because sometimes you'll perforate the implant out out one side or the other. So you have to really know where you're at to do a flapless procedure. So I'll kind of show some of this video and we can see the process. And maybe this is kind of boring for some people, but so I did not make an incision on the ridge. I just, because I knew where each site was and where the bone was, I could go ahead and I can prepare those holes directly. And then I use what's called a tissue punch. And I'm feeling my way around this in the osteotomy the entire time. And so here we're just preparing it, and I under-prepare the hole so that when I place this implant, I'm putting a bigger diameter implant into a smaller hole. And so I'll kind of move forward through this. You probably don't want to see all this, but you can see there I'm slowly driving the implant into the osteotomy, and then you'll see the burr kind of stop. When that burst, you can see it kind of skipping right now. When it stops, that means that I have a lot of torque on that implant. So I can load, and you can see I'm driving it in right now, and I'm getting about 70 Newton centimeters of torque on an implant that's placed in the sinus. So I have very high torque values on those implants. So anyway, so long story short, we went ahead and placed all the implants, and there we go. So it's the last one going in. And just driving it in and feeling as I'm driving that implant and I'm feeling it work. It's the osteotomy or the hole kind of pulls the implant up into the bone. And so that's anyway, so a little sidetrack there. But after this surgery, I saw him the next day, and he was a different person. Like he just, he was completely not the same guy when I met him on the day of his his consultation. His frequency was much higher. You could tell he felt a lot better, and he could tell that we were on a good trajectory to get his mouth restored. And that's kind of what I want to focus on. And when we have patients that end up, and these blue marks are just from us adjusting, and this is just a temporary, but when they go from having no teeth, missing their teeth, lost their teeth, they're starting to feel that hope that comes along with having something that's so important to us restored, and restored in a proper way. And so it's, when they are in situations like this or like this, we talk about pain and that sort of thing. Yeah, that's important, but more important is, achieving a goal that, when they've been in a kind of a difficult situation and getting, them in a situation where they've been self-conscious about their smile, unable to smile, and then restored to like that problem, like for her, it's gone.
Yeah.
You know, here, kind of self-conscious, you can tell, like she's learned how to put her lips in a certain position so as to not show her teeth. Now look at the difference here. You don't see that anymore, right?
Mm-hmm.
It's gone.
Yeah.
I mean, just within a matter of months, that thing that she was so self-conscious about, how her lips or how her teeth displayed, and she learned how to take the musculature around her lips to try to keep her teeth covered. Now that the teeth are restored, that issue is gone.
Yeah.
And I can't imagine, that would give me a headache if I had to do that all day, every day. Anytime I met somebody,
Yeah.
like how do I keep my lips down so I don't show my teeth, you know?
Yeah.
So
Of course. Yeah, another thing that I just kind of going along with that and all these myths and misconceptions that we're talking about, like usually I would say when I try to make a decision, I think about, like I even sometimes depends on how big the decision is.
yeah,
Like
it's
I'll
a
sit
huge
down-
decision. This is a huge deciation.
I'll write down the cons and the pros
Yeah,
of
it's a
doing
good
it.
idea, yeah.
And what people have to understand is that, and anyone who's ever done or gotten dental implants can tell you that the pros completely outweigh the
100%.
cons. Like
100%.
once you get the final prosthesis, and we say that because we see this every
Yeah.
day, and we understand that our viewers don't get to see this every day. Everyone has like the regular routines, right?
Yeah.
And like you'll watch a little bit about it and do some research, but this is what we do, 5 days a week. So when they see that final prosthesis, like all those myths, misconceptions, everything, like
Out the door.
the little bit of pain that they feel, any of that stuff, it's completely gone. Like they don't even have to look back, right?
Yeah.
It's just from that point on. I mean, keep the maintenance going, like we talked about,
yeah.
but yeah, just whatever myth, misconception, fear that they have about getting dental implants, like it's valid
Yeah.
because when you're trying to do something that you've never done, like you go into the unknown, like there's some fear that comes into play, but yeah,
For sure. And, that's where, I look at this list of, misconceptions and myths about dental implants. And in reality, Memo, all I can think about is the outcome.
Yeah.
It's like, well, yeah, these might be misconceptions or myths or even issues that patients might consider before the procedure. But after it's done, they're not relevant anymore. And that's why initially I kind of hesitate in answering these because I know that when it's all done and every single patient that I work on, when it's completed, we've solved so many problems,
yeah,
and restored them back to what their confidence, their ability to chew, eat, smile, and aesthetics are all restored. So it's pretty remarkable.
yeah, of course. Yeah, so I think that's time for us. From now on, we're going to be doing the live streams on
Thursdays. Yeah. So for anybody who watches these, we're going to move to Thursday at 9:30 doing our live streams. And if you guys, again, if you have questions or comments or you want to ask us in a DM regarding your case, we're happy to do that as well. The main thing is, as moving on in this week, just make sure and look for that hope and look for and know that your value is tremendous. And we don't. I say that because I see, kind of like I was talking about the patient who came in and was kind of down on himself or didn't have a whole lot of hope or was very self-conscious. And after kind of going through the process and starting to work on him, I could start to see him open up and the light starting to kind of turn on,
Yeah.
And so that's really what I want to provide is giving light and hope to people that are basically kind of down and out. And so
Yeah, and another thing is do research. Like go get, or do an online consultation or like find out more about it. Like watch our YouTube channel. Like we understand that it's a life-changing procedure, right? Really dive into it. If anything, you're going to learn more about it. And once you get them done, like you can help family members, friends, anything with the knowledge, the research that people have done. So
yeah, for sure. Yeah, it's a life-changing procedure. Of course, it's an investment, but it's also one of the best investments you can make in yourself if you're in these sort of situations that, things are kind of falling apart. We can fix it for sure.
Yeah. Like we always say, a well worth it investment, right? Everyone who's gotten dental implants, they're like, that was worth it. Because now, I think last week we saw a patient and he had just gotten his final prosthesis. And I always like to ask him when I see him, like, oh, how does it feel, this and that. And he was like, well, I'm still getting used to smiling. And I think we did an interview with him, so we have that. He's like, I'm not really used to smiling, so I'm still getting into that. And he was like, but man, I can eat whatever I want. He's like, I can have steak. Yes, he's like, I haven't had that in like 10, 12 years is what he said. So
yeah. I mean, they kind of forget, what they've missed out on for so many years. So
for sure.
Well, good. We thank you guys for watching our live stream today. Again, hit that subscribe and like button, and we'll see you next week, Thursday, 9:30 a.m. I'm Dr. Willardson here with Memo Hea, Trust Implants, trustimplants.com, and we'll see you next week.